Today we're ranking and explaining every cosmetic procedure according to the amount spent per year. I was surprised with number 1 having almost $2 billion being spent on it each year. But for now we're starting with number 27 at a yearly spend of $1,149,711. We have calf augmentation. This surgical procedure aims to enhance the appearance of calves by increasing their size and definition. Surgeons typically achieve this by inserting silicone implants or using fat grafting techniques to add volume to the calf muscles. At number 26, with a yearly spend of $3,385,561, we have pectoral implants. Pectoral implants are designed to enhance the contour and size of the chest muscles. During the procedure, silicone implants are inserted beneath the chest muscle to create a more defined and muscular appearance. At number 25, we're using more silicone with a yearly spend of $6,222,500. We have buttock implants. Buttock augmentation with implants involves surgically inserting silicone implants into the buttocks to increase their size, shape and projection. The implants are placed either within or above the glute muscles to achieve the desired aesthetic outcome. At number 24, with a yearly spend of $15,745,648, we have buttock lift, also known as a gluteoplasty. This procedure is aimed at lifting and tightening the buttocks to improve their shape and appearance. It involves removing excess skin and fat, as well as repositioning the remaining tissue to create a firmer and more lifted buttock. At number 23, we're jumping up at a yearly spend to $29,689,888. We have labiaplasty. Labiaplasty is a surgical procedure to alter the size, shape or appearance of the labia, the inner and outer folds of the vulva. It may be performed for cosmetic reasons or to address discomfort or irritation. Moving away from the private areas, we've got number 22 with a yearly spend of $45,813,503. It's lip reduction. Lip reduction surgery is performed to decrease the size or volume of the lips. This may involve removing excess tissue from the lips to create a more proportionate and balanced appearance. In number 21, with a yearly spend of $49,664,283, we have thigh lift. Thigh lift surgery aims to reshape and contour the thighs by removing excess skin and fat. It is often recommended for individuals who have experienced significant weight loss or have loose, sagging skin on the thighs due to aging or genetics. At number 20, we have lower body lift with a yearly spend of $66,826,465. A lower body lift is a surgical procedure that targets the abdomen, hips, buttocks and thighs. It involves removing excess skin and fat from these areas, as well as tightening the underlying tissues to create a more toned and youthful appearance. Number 19, with a yearly spend of $70,226,069, we have upper arm lift, also known as brachioplasty. An upper arm lift is performed to address sagging skin and excess fat on the upper arms. During the procedure, the surgeon removes loose skin and fat deposits, resulting in a firmer and more contoured arm appearance. Number 18 is lip augmentation with a yearly spend of $78,697,371. Lip augmentation techniques other than injectable fillers may involve surgical procedures such as fat grafting or tissue transfer to increase the size or alter the shape of the lips. These methods can provide longer lasting results compared to temporary fillers. At number 17, with a yearly spend of $78,735,335, we have something just for the men. It is breast reduction in men, otherwise known as gynecomastia. Yeah, sorry if I pronounce any of these wrong. You may be surprised to know that I'm not a surgeon. Gynecomastia surgery is performed to reduce the size of enlarged male breasts by removing excess glandular tissue, fat and skin. It aims to create more masculine chest contour and alleviate any associated physical or psychological discomfort. Okay, seeing as we're now going to break the $100 million mark, a like and subscribe will help me sort these out. With number 16, at a yearly spend of $104,897,965, we have buttock augmentation, this time with fat grafting. This procedure involves transferring fat from one area of the body, such as the abdomen or thighs, to the buttocks to enhance their size and shape. It offers a natural looking alternative to buttock implants and can also contour other areas through liposuction. Closely ahead at number 15, we have a yearly spend of $110,882,794 with breast implant removals. Some individuals may choose to have their breast implants removed for various reasons, such as dissatisfaction with the results, complications, or a change in lifestyle. The procedure involves surgically removing the implants and addressing any associated changes in breast tissue. At number 14 we have chin augmentation or mentoplasty with a yearly spend of $137,730,376. Chin augmentation is performed to enhance the size, shape or projection of the chin. This can be achieved using implants, bone restructuring or fat grafting techniques to create better facial balance and harmony. Jumping up to a yearly spend of $198,378,313, we're at number 13 with ear surgery or otoplasty. Otoplasty is a surgical procedure to reshape or reposition the ears for aesthetic or functional reasons. It can correct protruding ears, reshape misshapen ears, or address other concerns related to ear appearance or position. With only a little bit more yearly spend, at $198,532,175, at number 12, we have breast reduction for aesthetic patients only. Breast reduction surgery aims to reduce the size and reshape the breast for aesthetic reasons. It involves removing excess breast tissue, fat and skin to achieve a more balanced breast size and shape. Jumping up again with a yearly spend of $249,949,290, with number 11, we have dermabrasion. Dermabrasion is a skin resurfacing technique that uses a rotating instrument to remove the outer layers of the skin. It is used to improve the appearance of scars, wrinkles, uneven pigmentation, and other skin irregularities, resulting in smoother and more even-toned skin. Breaking into the top 10 with a yearly spend of $345,791,606, we have forehead lift. Also known as a brow lift, this surgical procedure aims to reduce wrinkles and lift sagging skin on the forehead and brow area. It can help rejuvenate the upper face and create a more youthful and refreshed appearance. At number 9 with a yearly spend of $396,918,394, we have cheek implants. Cheek implants are used to enhance the contour of the cheeks. During the procedure, silicone implants are inserted into the cheekbones to create a more defined and sculpted appearance. At number 8, with a yearly spend of $436,323,298, we have breast lift, otherwise known as mastopexy. Mastopexy is a surgical procedure to lift and reshape sagging breasts. It involves removing excess skin, repositioning the nipple areola complex, and tightening the surrounding breast tissue to create a firmer and more youthful breast contour. With only a few more places to go before we break the $1 billion mark, we have number 7 with a yearly spend of $603,004,313. We have abdominoplasty, also known as a tummy tuck. It is a surgical procedure to remove excess skin and fat from the abdomen and tighten the abdominal muscles. It can help create a flatter and more toned abdominal contour, particularly for individuals who have lost a significant amount of weight or have had multiple pregnancies. At number 6, with a yearly spend of $767,551,628, we have liposuction. Liposuction is a surgical procedure to remove localized fat deposits from specific areas of the body, such as the abdomen, thighs, hips, buttocks, or arms. It involves using a suction device to target and remove excess fat, resulting in improved body contours and proportions. At number 5, with a yearly spend of $871,883,395, we have breast augmentation. Breast augmentation is a surgical procedure to increase the size and enhance the shape of the breasts. This is typically achieved by placing silicone or saline implants beneath the breast tissue or chest muscle to achieve the desired volume and shape. Okay, we're at the final procedure before breaking the $1 billion mark, with number 4 at $925,226,869 spent yearly. We have neck lift. Neck lift surgery targets sagging skin and excess fat in the neck area to create a more defined and youthful neck contour. It may involve techniques such as liposuction, skin tightening, or muscle tightening to achieve desired results. Now the final 3 easily break the $1 billion mark. Starting at number 3 with a yearly spend of $1,339,507,738, we have eyelid surgery. Eyelid surgery is a surgical procedure to improve the appearance of the eyelids by removing excess skin, fat or muscle. It can address droopy eyelids, under eye bags and puffiness, resulting in a more refreshed and youthful eye appearance. At number 2, with a yearly spend of $1,876,157,413, we have facelifts. A facelift is a surgical procedure to reduce visible signs of aging in the face and neck. It involves lifting and tightening the facial tissues, removing excess skin and smoothing wrinkles and folds to create a more youthful and rejuvenated appearance. At number 1, with the biggest yearly spend, almost breaking the $2 billion mark, we have nose reshaping, with a yearly spend of $1,932,980,274. Nose reshaping is a surgical procedure to change the size, shape, or proportions of the nose. It can address aesthetic concerns such as a bump on the bridge of the nose, a crooked nose, or a bulbous tip, as well as functional issues like breathing difficulties. Thanks for watching to the end. Just to let you know, I'm working on the next Explainable Stuff video, and when it's done, it will be uploaded right here.